Where do you see this type of technology going? Do you find there will be more? I'm sure there will be more advances, but is that something you're kind of looking forward to? Are you more looking at, hey, let's get more research off of what we have here. Let's keep trying to understand the mechanisms of EBOO right now. Or are you like, hey, we could add in maybe another something here or there, or improve on this as we get to the next generation of machines?
Yeah, all of that.
All of it.
I mean, I mentioned EBOO is coming on the scene more. There's going to be more and more offices offering it over the next few years, which is fantastic. Uh, but it's nice to get out of the anecdotal stage and get more research. I mean, the more research we have behind us, the easier it is to talk to just the realities of what something is actually going to do. And so I think, I'm not one of those people who's like, we have to have research before we do something. I think that's like an antiquated way.
Yep.
I love just thinking about things logically. Okay, what are the holes that we're not doing for you in front of me, right? And so I'm, I might have a bad connotation, but I'm a little bit of a cowboy. Like I want to go because I want to get results for my patients. So I'm going to think outside the box and be a leader and be an innovator, and I'll have some fails, but I try to communicate that to the patient. Hey, this is a little bit of an experiment, right? Do you want to be part of this? Do you feel safe doing that? Are the potential pros, do those outweigh the potential cons, right? And so it's just about having that conversation and making sure the patient in front of us is voluntarily as knowledgeable as possible so that we can push the envelope while kind of in the background trying to pull research, some amount of research along with us. And especially with all the biohacking nowadays, it's like, what pieces of technology or what nutraceuticals do we combine with an EBOO session to make it most optimized? And is that a certain way for one patient versus a little bit of a different way for the next patient? Right. And so how do we create a personalized approach to EBOO? It's like, if EBOO is the protocol, we want to know how to step outside of that protocol for whoever's in front of us. And so it might be EBOO with something else, but hormesis, it's like too little of a good thing is not therapeutic enough. Too much of a good thing is not therapeutic at all and is toxic, is a poison in and of itself, right? And so it's that's why they call it the practice of medicine, right? It's a practice. But I think it's really important for the patient to be as in the know as possible. Yes. And be just that teammate. And so we can kind of be the leader, get out there, think outside the box for the patient's benefit, but also bringing research along the way would be lovely.
Absolutely. I think the research always validates in a patient's mind what is going on a little bit more, makes them feel more comfort. And I think that is necessary in healing. You can't have a true skeptical, fearful approach when going into healing and expect the best results from that. You want to be in a comfortable and kind of more belief system that this will work and look at all this data. But at the end of the day, each patient is an experiment, right? Each patient is so unique and so different. We could show you all the data in the world. The data won't solve the problem. It's how you apply that data and utilize it. So truly appreciate that answer there.